Hi class, this is Amy, just going over TLO 2.6 perioperative safety. I'm just going to start out talking about some surgical overview and surgical safety. The first thing I want to discuss are just some overall things to be aware of, like reasons for surgical procedures, cosmetic surgery. You guys are probably familiar with that, often called plastic surgery. Curative surgery are going to be the types of surgeries that are used to um, essentially cure the patient, right? So, somebody having a gallbladder removal for like cholecystitis. Diagnostic, when people have like a breast biopsy, um, when a lump has been identified, patients that come in for like a knee arthroscopy to see what's going on in there prior to having perhaps a bigger surgery. Palliative procedure, this is something that's getting to be a little bit more common as well. This is something that's done to help increase the patient's quality of life, but it's not curative in any way. So sometimes you'll see this with your cancer patients, like they might have a nephrostomy tube placed. It's not going to cure them, but it's going to make their life better while they are alive. Preventative, one of the best examples of this is, our patients who get the bilateral mastectomies when they have found genetic mutations that put them at a high risk. Reconstructive surgeries. This is where they're essentially replacing any damaged structures, like a total hip replacement, total knee replacement, and then transplant. So pretty straightforward there with heart and kidney transplants. You'll often hear, especially during COVID, you guys probably heard a lot about elective surgeries versus like emergent surgeries. So, elective obviously are things that are done for non acute. It's not something that needs to be done, and it can be put on the back burner for a while. Urgent, it does need to be done soon. We wouldn't want to delay it more than like 24 to 48 hours. And then emergent is when they need to be taken back to the OR right away. So good examples are like a triple A or a gunshot wound, that sort of thing. And then surgical approach. We've got simple, minimally invasive, and radical. Let me move me so that you can see that a little bit better. Radical often is when this surgery is really extensive and they're removing areas around. So, like when we talk about, we'll talk about radical mastectomies, and when they do that, they're removing the breast tissue, the muscle, lymph nodes around. That would be considered radical. All right, let me move me again so you can see a little bit better. So, looking at safety first, there's a lot of things that we do in the surgical setting to be sure that safety is maintained. One thing I want to start by looking at is the 2023 Joint Commission Hospital National Patient Safety Goals. This is something you should be familiar with. They update these every year. They tend to be quite similar unless they're seeing improvement. So, prevent mistakes in surgery. This has been on here for quite a few years. Make sure that the correct surgery is done on the correct patient and at the correct place on the patient's body. Mark the correct place on the patient's body where the surgery is to be done, and pause before the surgery to make sure that a mistake is not being made. That is called a timeout. And this is something that's on the National Patient Safety Goals because it's still an issue in healthcare. Surgical errors still happen. I wouldn't say frequently, but the statistics are always alarming when you see them because you don't think about it happening. The surgical safety checklist here is another safety measure that's used. It is started from the very beginning, like when surgery is scheduled. It starts with a surgery scheduler, it's used in pre-op, and then it's used in the OR and before the patient leaving the operating room, and it includes like counts on sponges and that sort of thing. And that is where the timeout is also incorporated. And that timeout is where they stop to verify that they have the correct patient, they have the correct surgery, they have the correct place, looking for those initials where the body's been marked, um, to ensure that no errors are being made. SBAR, you guys have probably heard a lot about SBAR, situation, background, assessment, and recommendations. So SBAR is a form of communication we use frequently in the healthcare setting, even among physicians, proposals, all those things. You'll become very familiar with that. Team steps is another strategy that's used to ensure safety in the surgical arena, and really focuses on working together, what knowledge and attitudes are needed to achieve good patient care, leadership, communication, that sort of thing. And then there's also surgical goals specific to surgery that are here, that are monitored. So we look at things like patients that are going to surgery and they normally take beta blockers, that they are getting that on admission during the perioperative period. So when we talk about patients in their preoperative phone calls, a lot of times patients hold a lot of meds, but there's certain meds we do want them to have. And we want our patients with a beta blocker to take their beta blocker before surgery. Prophylactic antibiotics given prior, within 1 hour of the surgical incision. So generally, the couple places I worked in pre-op surgery, the preoperative nurse will prep the antibiotic, but it's actually started by the OR nurse or the anesthesiologist as they roll the patient back to surgery to ensure that it's done within that 1 hour period. Appropriate antibiotic selection for surgical patients, so making sure they're getting an appropriate antibiotic, and also that those antibiotics are discontinued within 24 hours after surgery. Cardiac patients with controlled glucose, right? Because we know that impaired glucose can affect surgical healing. Appropriate hair removal, the method of removing hair, and removing hair when it's needed. So we know that hair can be an infection control issue, but we also know if it's not removed in the right way, it opens up an opportunity for infection. So making sure that hair removal is appropriate. Get colorectal surgery patients back to normal temperature after surgery. So normothermia in surgery is a big thing. VTE prophylaxis is also very important. So making sure that your surgical patients have some sort of VTE prophylaxis, whether that's mechanical or pharmacological. And that sums up your safety. And I will follow up in a moment with the pre-op overview.